In the last 10 years, we have started a new era where the knowledge we have about the effectiveness of prevention has accumulated in a way that was not foreseen. And we have not done enough to share this information with decision makers. In sum, prevention is the most effective and cost-effective way to deal with crime, and it has strong scientific evidence to support that. Now, part of that scientific evidence is that we've had a number of major large-scale studies that have looked at the life cycle from birth to age 25 and later. And these have been done in a number of different countries. There have been some done in Canada, but they basically all show the same thing. And what they show is that the greater number of negative life experiences as you grow up, the more likely you are to be a persistent offender. And those negative life experiences include being born in poverty, being brought up by parents in a very inconsistent, uncaring way, almost child abuse, running into difficulties at school, dropping out of school and having difficulty maintaining employment. Now, those are important because they show where we should be focusing resources upstream as opposed to just reacting to crime, reacting to 911 calls. And key government and intergovernmental agencies have accumulated the results about what actually works to tackle those risk factors, so what is preventive, and so reducing crime. And these governmental agencies and intergovernmental agencies include household names like the World Health Organization. Who else can you rely on? The US Department of Justice, that strangely shows that prevention is the most cost-effective way of dealing with things when in fact it is promoting the very opposite. The Washington State Institute on Public Policy has become the place to go on those cost-effective studies that are so important in changing the way that we deal with crime. So let me just give you a few examples of the sorts of crime prevention programs that have been effective. So some of those focus on negative risk factors in the family and in youth in problem places. Problem places are basically those areas in cities where you've got a concentration of disadvantage, where you've got a lot of family breakdown, and where you don't have a lot of stability. And the ones that are amongst my favorites, and my favorites come from looking at hard data, include the youth inclusion programs, originally invented in England, that show a 30 to 50% reduction in offending, and they've shown this over in a national program, not just in one small project. Multisystemic therapy, basically developed in the US, is one well known to the Canadian National Crime Prevention Centre. Cure Violence, you probably heard of because it gets publicity in terms of preventing gang violence by intervening with them. Mentoring and Mentoring Plus are also well known. That's basically big brothers, big sisters. Now, we can also tackle risk factors in schools, but these apply more to kids who are still in school. But they're very important for the sorts of crime that they reduce. So we're going to be legalizing cannabis, and we've been living an opioid crisis, and we're still living a less visible crisis around cocaine and heroin. And of course, the real dangerous drug is actually alcohol in all this. And we know that school curricula that include life skills can significantly reduce the use of alcohol, use of drugs, and by the way, also violence. Unhealthy sexual relationships, the publicity in Canada has been given to sexual assault, focuses on the police role and the courts, but the real solutions to stopping sexual violence are simple things like including in curriculum in school around grade 9 and 10 a program developed in Ontario, tested in a random controlled trial called Fourth Hour. You see a reduction of about 50% in sexual violence as reported by both those who are violent and those who are the victims of violence. In universities, bystander intervention has been shown, although almost no university is requiring this in a compulsory course at the beginning of a student's first years at the university. Another Ontario program that is well known is Stop Now and Plan. You also see very large reductions from this. Now, some work is needed in the police area. This is basically taking police officers off responding to patrol and off the detective work and focusing on partnerships with social agencies. This is what the City of Glasgow did and saw a 50% reduction in violence within a 3-year period. Problem-solving policing now well known, and what's called focused deterrence. This is really focusing on specific behaviors, specific people, and where deterrence can make a difference. There are also actions that can be done in the health sector. For instance, when a victim of gang violence, somebody who was knifed, somebody who was shot, goes to hospital emergency room, yes, it's important that that person gets health care, but it's also a critical moment in that person's life where it's possible to intervene to help them get out of that way of life. And these have shown very good results. There is one example in Winnipeg, but these have been in hospital emergency rooms in other places, but not in Canada. There's a need to focus on post-traumatic stress disorder. Yeah, we know about it in first responders. We forget that victims of violence also get PTSD. And we can also use data from the hospital emergency rooms to guide social services and police to solve problems. Now, we have very strong evidence on the proof of cost effectiveness, and this is important for politicians because this has to do with how you invest and what return you get in your investment. The Washington State Institute is the go-to place for this. It's a group that works directly for the legislature, and you see different returns, but these returns a 1 in 4 return. If you're thinking of putting $1,000 into a mutual fund and you think that you could get $4,000 within 5 years, wow, well that's where we are today. There are a number of proven actions where you can get returns that are 4 times what you invested. I use 7 times a lot, but there are even some where you can get much more than 7. Public Safety Canada has looked at this. This diagram is a little bit difficult to follow, but what this basically says is that if you took 3 of the programs that I mentioned, youth inclusion, SNAP, that's Stop Now and Plan, and multisystemic therapy, that you could reduce by about 1/3 the costs of a criminal career. Now, I think that minimizes, I think the evidence actually shows much greater reductions, but then you have to include some of the other actions that I described earlier. Canada must find more cost-effective ways to deal with crime, ways that are evidence-based, that are compassionate to victims and protect the public. The Canadian Municipal Network on Crime Prevention has proposed 3 key actions. One is to establish offices for crime prevention in all orders of government. The second is to organize an annual conference so that people and agencies engaged in prevention can share their successes and can develop new solutions. The third is a partnership between federal, provincial, territorial governments and municipalities to ensure a serious investment in prevention. If these three actions occurred, costing the equivalent of 10% of what we currently are spending on reacting to crime, we could expect significant reductions in crime before 2030. 1 million fewer victims of assaults and violent crime, 2 million fewer victims of theft and property crime. This would save about 25 billion or more in harm to victims. The required investment is important, is 2 billion, but this would counterbalance the 6 billion that we have added in the last 15 years to the reaction budget, but would achieve potential savings in reaction costs of 4 billion or more annually.